Thanks. All right, meantime, newly released data from New York City shows that black residents are twice as likely to die from the coronavirus than white Americans. This as numbers from Louisiana show that African Americans account for 59% of the state's deaths, despite making up just 33% of the population. And other states can attest to 2 and 3 times disparities as well between blacks and whites. Joining me right now to discuss is Marc Morial, the president and CEO of the National Urban League and the 59th mayor of New Orleans. Good to see you, Marc.
Hey, good to be with you.
Thank you so much for being so patient today. We've had a lot of breaking news. So what is, the Urban League suggesting, should happen to address the systemic disparities contributing to the now disproportionate numbers?
So the first thing to understand is that these chronic conditions and these health disparities have been part of reality for a long time. Mm-hmm. And what the coronavirus has done is shed a light on long-standing, if you will, disparities. And these disparities are between blacks and whites, whites and Latinos, mm-hmm. as well as whites and Native Americans and American Indians. So it's a widespread set of disparities. With respect to blacks versus whites, the data is now showing a disproportionality in the severity of the disease and in the number of deaths by African Americans. But let's underscore this. This is not, quote unquote, a black disease or a Hispanic disease. This is a disease that affects everyone. It's just disproportionate in how it's impacting African Americans.
Right. So many contributing factors. Yeah, contributing factors from, uninsured, underinsured, poverty, lack of access to health care as a whole. And like you said, a lot of pre-existing conditions. So now the Urban League, with your leadership, is now suggesting that there needs to be some priorities in the rescue plans, the national rescue plans. What are you proposing? And what do you think is going to realistically, be tackled?
So the National Urban League, we're working on 2 fronts. On one front, we're working on the ground in community after community, hosting virtual career fairs. At one Urban League affiliate, we're doing testing. In others, we've conducted food drives to make sure that food insecurities are being dealt with. We're an on-the-ground economic first responder. On the broader policy front, from a systematic standpoint, we need to expand Medicaid. We need to make sure that these states that refuse the expansion embrace the expansion. We need to, I believe, lower the eligibility age for Medicare from 65 down to 50. We need to create a public option, and what we need to do is create an airtight system so that all Americans have access to quality health care through an insurance system.
And you're hopeful this could happen in the short term?
It can happen if the will of the leadership of this country is here. Doris Kearns Goodwin was on with you earlier. This is a time when leaders have to rise. And these systemic, both economic and health inequities need to be dealt with. What we don't want to do is just do a paper over fix with respect to the responses by the federal government. So there are a long list of things that need to be done. The Paycheck Protection Program was ingenious in its design, and I think there are lots of problems in its execution. You now see that major corporations applied through their subsidiaries to get under the 500 employee threshold, and therefore took money away that was supposed to be for small businesses, and many very small businesses didn't get an opportunity to participate in that. So that's, there's got to be a fix on some of the elements that are designed to be the bridge over troubled waters. But long term, we've got to fix the broken public health system by investing in it, doing it in a smart way, and doing it in a way that's equitable.
Got you. All right, Marc Morial of the Urban League, thank you so much. Be well to you, your wife Michelle, and the rest of the family. Stay well.
Thank you.